Dr. Singh, you have the floor.
Honorable Chair, Vice Chairs and members of the Executive Board, Director General, 10 years ago, I stood before you as the Regional Director-elect with a vision that was grounded in a commitment to create a WHO Southeast Asia region that was more responsive, inclusive, and accountable. To maximize WHO's impact based on priorities and needs of member states that later led to our flagship priorities. Today, after a decade, I stand before you again, grateful for your trust, humbled by your support, and indebted for the insight, commitment, and wisdom of each of the region's member states, which together constitute 1/4 of the world's population. What began in 2014 with the attainment of region's polio-free status has now closed with the end of the acute phase of COVID-19 pandemic. 2 bookends of a transformative decade. I am particularly proud of the achievements against communicable diseases, having attained more than 23 eliminations from 1 or more countries of our region against key global priorities such as malaria, EMTCT, and an array of neglected tropical diseases. Together, we have achieved tremendous progress on universal health coverage. Of the 270 million people projected to be covered by UHC over the course of WHO's 13th General Program of Work, 110 million, more than 40%, are from the Southeast Asia region. The total population in the region, impoverished due to health spending, has substantially reduced from almost 32% in 2000 to about 7% in 2019. Since 2014, the availability of doctors, nurses, and midwives in the region has increased by over 30.6%. Today, IHR core capacities in the region are above the global average. Our innovative Southeast Asia Regional Health Emergency Fund, created after the tsunami, which claimed 200,000 lives in the region, has supported over 43 emergencies in 10 countries of the region and continues to strengthen preparedness capacities. 5 countries from our region have already achieved the 2030 SDG target rates from newborn and under 5 mortality. Between 2015 and 2020, we achieved the world's highest annual rate of reduction of maternal mortality. And between 2014 and 2021, the reported incidence of measles and rubella in the region was reduced by 86% and 78% respectively. Today, the probability of dying prematurely in the region from non-communicable diseases is 2 percentage points lower than it was a decade ago. And in 2022, several of the region's high TB burden countries initiated more people on treatment than in 2019, a noteworthy achievement. And let us recall, these numbers represent real people with real lives that have been saved or changed for the better. All these accomplishments can be attributed to the programmatic reforms implemented, compelling us to venture beyond our comfort zone and embrace innovative approaches. Guided by strategic directions, we implemented outcome-driven flagship programs with time-bound milestones. We directed 80% of the region's resources to WHO country offices to maximize impact at country level. This commitment was reinforced through 24 ministerial meetings, showcasing heightened political commitment in the region. We prioritized program evaluations to make timely adjustments and focused on collaborations and partnerships. In all our initiatives, our focus has centered on vulnerable populations, ensuring that the principle of no one is left behind is upheld. Notably, knowledge generation flourished, exemplified by the release of over 450 documents across diverse categories in the past decade. In my travels across the region, I'm struck time and again, not just by the resilience, but the optimism that is so often expressed from health and care workers to policymakers and partners to civil society, community groups, and high-level leaders, including heads of state. And yes, optimism, even in the shadow of the deadliest, most disruptive health crisis in more than a century, the COVID-19 pandemic. And yet, I'm not at all surprised, because what together we have achieved is out of the ordinary. Together, we could not have done together, since we could not have done it alone. To this executive board, its chair and vice chairs, and to all those who have been here during my tenure, I express my utmost gratitude. As a region, we have benefited not just from your support, but from your responsiveness to our collective ambition to strengthen global health governance, to shape the global health agenda, and to fulfill the right of every person everywhere to the highest attainable standards of health. To the Director General, Dr. Tedros, I extend my sincere and abiding thanks. You are a true leader and an inspiration, working around the clock, fearlessly, always ready to extend a helping hand. You have been an implacable champion of our region. We are extremely grateful to you, DG. To my country, India, who put forth my nomination and supported me wholeheartedly, my heartfelt thanks. My special thanks to the Health and Family Welfare Minister, Dr. Mansukh Mandavia. I was fortunate to receive abiding support throughout my tenure, including for a new WHO CRO building, for which India generously allocated $300 million and planted trees with the ministers of the region during the last RC. We value your leadership. To my successor, Ms. Saima Wajid, I offer my felicitations and warm wishes. You will lead a region that is resilient, capable, and committed to the health and well-being for all its people. You have an accomplished team, and with your expertise, the region will reach greater heights. I wish you every success. And most importantly, to the member states and to excellencies from across the region, past and present, I extend my heartfelt gratitude for your unyielding solidarity. Throughout my tenure, in moments both trying and triumphant, and at every step of the way, you have given me your steadfast support. Together, you have shown not just the vision and will, but the capacity to deliver game-changing programs, driving impact where it matters most, at the grassroots and in the lives of the most vulnerable. And you have also shown that together we can speak with one voice and shape the global health agenda, drawing on our rich history and shared legacies, especially in helping to catalyze and now accelerate the primary healthcare movement. This is what global health equity is all about, and what we at WHO are committed to delivering. And I also want to express how truly I was moved by statements you made at our recent regional committee meeting in November 2023. Statements, and I quote, "Making CRO the pride of WHO. The region is capital for disease elimination, and that the flagship programs have been game changers." And many more such statements which were very touching. My heartfelt thanks to all of you. To our partners and friends, I extend my warm thanks and heartfelt commendations. Your collaboration has been critical to each one of our achievements and will continue to be. And to all staff of WHO in Geneva, in the region, and in country offices, I extend my utmost appreciation. Your contributions are as diverse as they are valuable, and your commitment to excellence, which it has been my privilege to witness over so many years, has set new benchmarks, which I urge you to take forward in the months, years, and decades ahead. To my colleague RDs, I thank you for your collegiality and support, which was always so forthcoming. Excellency board members, after 25 years of work in WHO, first as the executive director in Geneva, and then as deputy regional director, followed by regional director in the Southeast Asia region, now is the time to say goodbye. With pride and gratitude, with memories and friendships, and with a heart that is heavy but profoundly fulfilled. But most of all, with the optimism that after a decade of work, it is today that defines our region, which will enable us to achieve our ambitions for health, for well-being, and for a more equitable and sustainable region and world for all. I thank you.